Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Shock. Collaborative care for shock. Table 7 shows the collaborative care for the types of shock. Cardiogenic shock. Under oxygenation. Provide supplemental oxygen, for instance, nasal cannula, non-rebreather mask, intubation and mechanical ventilation, if necessary, and monitor central venous oxygen saturation. Under circulation. Restore blood flow with thrombolytics, angioplasty with stenting, emergent coronary revascularization, and reduce workload of the heart with circulatory assist devices, such as intra-aortic balloon pump and ventricular assist device. Drug therapies includes nitrates, for instance, nitroglycerine, inotropes, for instance, dobutamine, diuretics, for instance, furosemide, and beta-adrenergic blockers, but contraindicated with decreased ejection fraction. Supportive therapies include treating dysrhythmias. Hypovolemic shock. Under oxygenation. Provide supplemental oxygen and monitor central venous oxygen saturation. Under circulation. Restore fluid volume, for instance, blood or blood products, crystalloids. Rapid fluid replacement using two large bore, 14 to 16 gauge, peripheral intravenous lines or central venous catheter, and endpoints of fluid resuscitation. 1. Central venous pressure is 15 mm mercury, and 2. Pulmonary artery wedge pressure is 10 to 12 mm mercury. Supportive therapies includes correct the cause, for instance, stop bleeding, GI losses, and use warmed intravenous fluids, including blood products, if appropriate. Septic shock. Under oxygenation. Provide supplemental oxygen, intubation and mechanical ventilation, if necessary, and monitor central venous oxygen saturation. Under circulation. Aggressive fluid resuscitation, for instance, 30 ml per kilogram of crystalloids repeated, as long as hemodynamic improvement is noted, with an endpoints of fluid resuscitation. 1. Central venous pressure of 8 to 12 mm mercury. 2. Mean arterial pressure of greater than or equal to 65 mm mercury. 3. Urine output greater than or equal to 0.5 ml per kilogram per hour. And 4. Normalized lactate levels. Drug therapies includes antibiotics as ordered, vasopressors, for instance, norepinephrine, inotropes, for instance, dobutamine, and anticoagulants, for instance, low molecular weight heparin. Supportive therapies includes obtain cultures, for instance, blood and wound, before beginning antibiotics, monitor temperature, control blood glucose, and stress ulcer prophylaxis. Neurogenic shock. Under oxygenation. Maintain patent airway. Provide supplemental oxygen and intubation and mechanical ventilation, if necessary. Under circulation. Cautious administration of fluids. Drug therapies includes vasopressors, for instance, phenylephrine and atropine, for bradycardia. Supportive therapies which includes minimize spinal cord trauma with stabilization and monitor temperature. Anaphylactic shock. Under oxygenation. Maintain patent airway. Optimize oxygenation with supplemental oxygen and intubation and mechanical ventilation, if necessary. Under circulation. Aggressive fluid resuscitation with colloids. Drug therapies includes epinephrine, IM or IV, antihistamines, for instance, diphenhydramine, histamine, or H2 receptor blockers, for instance, famotidine pepsid, bronchodilators, nebulized, for instance, albuterol, and corticosteroids, if hypertension persists. Supportive therapies includes identify and remove offending cause, prevent viravoidance of known allergens, and paramedic with history of prior sensitivity, for instance, contrast media. And lastly, obstructive shock, under-oxygenation, maintain patent airway, provide supplemental oxygen, and intubation and mechanical ventilation, if necessary, under circulation, restore circulation by treating cause of obstruction, and fluid resuscitation may provide temporary improvement in cardiac output and blood pressure. Supportive therapies includes treat cause of obstruction, for instance, viricardiocentesis for cardiac tamponade, needle decompression or chest tube insertion for tension pneumothorax, and embolectomy for pulmonary embolism. Thank you for listening. Have a good day and be safe. Agyamanak.